Welcome back. Time for your Eye on Health. All right, last month we talked about medical tourism. That's when people travel to another country or state specifically for medical care, but it can often be risky. Plastic surgeon Daniel DeLuca-Pytell is here with us again in studio to talk more about this topic. Very interesting conversation that we had before. We definitely want to get this information out to people.
Yes.
So one thing that we see is clear. A lot of times people do this so that they can try to save money. But in the long run, in a lot of cases, it ends up costing them even more.
That's totally correct. So a lot of people will travel to other countries to save money, or maybe they'll find a good deal in Miami, which is a popular hub in the United States for plastic surgery, where these surgeons might be doing multiple cases a day and then not providing adequate care post-operatively for their patients. And what happens when you return home with a problem? Well, you go to your local emergency room, where the person that then is going to be taking care of you doesn't really necessarily know what's happened, and that creates, additional unforeseen medical expenses. And that's just to treat the medical problem. So let's say somebody has an infection and they require a hospitalization for antibiotics, or maybe their wound opens up and then they have to have care in order to get that wound closed, or other surgeries. That's just to heal from the complication. That doesn't even touch what has to happen from a revision standpoint to make the surgery look right after somebody's already spent money to go and have a cosmetic operation. So there's lots of layers to this issue. And then unfortunately, a lot of the patients that are going to save money don't have health insurance, and then that puts a strain on our system. So it becomes a lot of times it's a strain on the Medicaid system, and it creates a big ethical dilemma for what people are supposed to do.
Why do you think people are so desperate for this work, depending on what it is, that they're willing to take such a big risk?
I'm not entirely sure, because I spend time in my office counseling patients on whether or not surgery is a good idea for people. And there are certainly operations that are available in this country that people can have, but I think the lure of having perhaps everything done at once, or everything done in a destination location, and perhaps some false advertising thrown in. We like what we see on social media, and a lot of times, I don't know about you, but sometimes I get sucked into some inexpensive product that, when it arrives in the mail, it turns out to be not so good.
Yeah.
When you're doing that with your health, you're just asking for trouble.
And Dr. Patel, you bring up a very valid point that, when you have a surgery, sometimes that's a risk regardless, even if you do it here. But at least if you do it the right way, you can follow up with that same doctor. They're going to want to see you again and check on you. If you go get a botched surgery, you're putting yourself at a huge risk, and then the doctors have to figure out here what went wrong.
Yes, and it really also interferes with the relationship between the person who is in desperate need of care and then the person that has been just selected by the basis of a call schedule, whether or not that person can help them.
Mm-hmm. And you also talked about social media and people getting lured in.
Mm-hmm.
I know, too, sometimes people will show their before and afters very quick. When it worked, do you think sometimes maybe people aren't considering all of the risks, especially as it relates to their health?
Oh, totally.
They just see that quick little image there.
Completely. One of the things that I was taught is that you don't show an on-table result. You have to wait until the healing has finished. And I was taught you don't show a result until it's been a year. So when people are showing an immediate after picture, okay, it looks nice on the table, but what happens after? Does the person have any problems with their skin? Is their skin compromised? Have they been too aggressive with liposuction and caused injury that might cause somebody harm? Have they gotten the appropriate postoperative care so they're not collecting fluid or having infections? It really goes on and on. So I find that I am now having to counsel my patients more that you have to remember that you're not going to see the final result right away. It is normal to come in the first week after a tummy tuck weighing more, because you're swollen, you're carrying extra fluid, your clothes aren't going to fit right, and that's totally normal and totally expected. But social media makes it harder because in a reel it takes 30 seconds to go from before the surgery to in a bikini, and that's just not reality.
Yeah, just the illusion of it. Obviously, you're very experienced in your practice, so you know what to do. Anything you want to say to people just in terms of letting them know that there are other options even for those payments? I know a lot of surgeries aren't necessarily covered with insurance, but there are some options out there.
Sure. So I think it's really important for people to visit a bunch of different surgeons. Some people don't charge consultation fees. I no longer do because that was, making it hard for some people who might otherwise be good candidates. You need to figure out what a reasonable cost for surgery is so you can make that plan ahead. I mean, I think budgeting is important for anything, and you need to budget for your procedures, then figure out what really is worth it. Just because you're in the surgery suite doesn't mean you have to try to do everything all at once. Maybe having one quality operation and then perhaps planning something a couple of years later is better than trying to jam it all in at once in a substandard way.
Okay, Dr. Patel, always bringing us words of wisdom. We appreciate it.
Thank you very much, Terrence.
Thank you.